Hi everyone, today I am giving you explanation on the topic ptosis. This is the ptosis part 4 which consists of the different tests to evaluate the ptosis. Now the first test is MRD1. The MRD stands for the marginal reflex distance. In case of MRD1, we will measure the distance between the corneal reflex to the upper eyelid. Let us understand with the help of example. Now here this is the upper eyelid and this one whitish dot is the corneal reflex. The distance between the upper eyelid and the corneal reflex is measured, which gives us explanation or which gives us the value of the MRD1. This was the MRD1 test. Let's move to the MRD2. Now MRD again stands for the marginal reflex distance. In this case, we will measure the distance between corneal reflex to the lower eyelid. Okay. Suppose this is the corneal reflex and we have to measure the distance from the corneal reflex to the lower eyelid. Okay, this gives us the value of MRD2. So the main difference between the MRD1 and MRD2 is that in case of MRD1 we have to measure the reflex distance from the upper eyelid to the corneal reflex, and in case of MRD2 we have to measure the distance from the lower eyelid to the corneal reflex distance. Okay. Now MRD3, measure the marginal reflex distance is its full form. So in this case we have to add the distance between the MRD1 and MRD2. We have already taken the test for MRD1 as well as MRD2. Now in the case of MRD3 we have to add both of them. So we will get the value of MRD3. Next test is palpable fissure height. Now measure the vertical height of the visible part of the cornea between the lower and the upper eyelid. In case of palpable fissure height, we have to measure the visible part of the cornea. Now this is the visible part of the cornea and we have to measure the vertical height of the visible part of the cornea. This gives us the palpable fissure height. Okay. In case of adult male, this height is 10 mm, and in case of adult female this height is 12 mm, or we can plus minus 2, which means it will be 10 mm or it will be 14 mm, which means in this value we will add 2 or sometimes we will subtract 2 are the normal values of palpable fissure height. Now let's move to the next one, Levator function test. Now Levator function test, it is also known as the Burke's test. In this case we will follow some procedure for doing this test. We should ask the patient or guide the patient to look down. The patient is always allowed to look down. Thumb of one hand is placed firmly against the eyebrow of a patient. Now the thumb of the examiner is placed against the eyebrow of a patient. From this portion we will block the action of frontalis muscle. Frontalis muscle are present almost at our forehead, so by doing this we will block the action of frontalis muscle. Patient is now asked to look up. Now we will ask the patient to look up. Amount of extrusion is measured by the ruler held in the examiner's hand. Now this is the ruler and exclusion is measured with the help of the ruler. This one is the ruler. Okay, so exclusion is measured with the help of this ruler held in the examiner's hand. Now it will give some values. If the Levator function test is normal, then it will give the value of 15 mm. If it is good, then it will give the value of 8 mm or more. If it is fair, then 5 to 7 mm value is given. If it is poor, then 4 mm or less value is given. Now let's go through one set. First of all, we should allow the patient to look down. Thumb of our hand is placed against the eyebrow of the patient to block the frontalis muscle function. Now patient is asked to look up and then amount of exclusion is measured with the help of examiner. This was the whole procedure I have explained again. Like this we have to measure with the help of ruler. Now move to the next one, which is the Bell's phenomena test. In this case, ask the patient to close his or her eyes. Now we have to guide the patient to close his or her eyes. When we ask the patient to open his eye voluntarily, then open up and out rolling of the eye is present. Now we should always ask the patient to close the eye, but when the patient opens his eye, then the eye gets out roll and like this is the position of the eye. Okay, from the normal position it get changed to this position. So this one is the Bell's phenomena. So on the basis of this we will indicate that the Bell's phenomena is present or not. Let's move to the next one, which is the Marcus gun jaw winking test. Now in this test we should ask the patient to chew with the masculating movement of the jaw. In this case, when the patient starts chewing, now let us understand with the help of diagram. This is the ptotic eye. Okay, when the patient's mouth is closed, then its ptotic eye is showing ptosis. Okay, when the patient mouth is open, then the ptotic eye gets open. So in this case, with the help of the masculating jaws, the function of the ptotic eye occurs, or the function of the ptotic eye takes place. So this one is the Marcus gun jaw winking syndrome. We have to notice the elevation or open up of the ptotic eye. Sometimes it will be very high, sometimes it will be very small to notice, or very rare to notice. So we have to take care Marcus gun jaw winking test or syndrome is present in the patient or not. Next one is lid lag. In this test we have to take the horizontal object like the ruler in front of the patient eye. We have to take the any horizontal object in front of the patient eye. We should move the ruler up or down, and we have to notice at the same time simultaneously when we are taking the ruler up, then the patient of the eyes should be up seeing, and when we are down position of the ruler, then at the same time the patient's eye should be looking down. Along with the ruler their movement should be there. If the movement is not with there or not with that speed, then we will show that this is the lid lag. Lag means lazy lid. Okay, this was the end of the topic ptosis.